Welcome to the first ever virtual AANA Mid-Year Assembly as we make history together. It's one of the most rewarding and exciting professional meetings around, and I was really looking forward to welcoming CRNAs and SRNAs from around the country to advocate for our profession in our nation's capital. In normal times, I would be talking to you in person in Washington, D.C. We all know these are far from normal times, and in a matter of weeks, the world has changed drastically. Quite simply, we, all of us, are experiencing a worldwide disaster, the COVID-19 pandemic. What hasn't changed is the importance of advocacy and the AANA's commitment to supporting our members through this crisis. In this extraordinary time, the AANA has brought all hands on deck to marshal its efforts and resources to advocate for the well-being and safety of our members. Every day brings new challenges. I would like to update you on some of the many initiatives the association has taken to respond to the coronavirus crisis. The AANA Professional Practice Division staff are working around the clock to ensure that CRNAs are provided guidance and support. We're working with other organizations to keep CRNAs safe. The AANA has partnered with the American Society of Anesthesiologists and the Anesthesia Patient Safety Foundation to issue a joint position statement on the best use of PPE by professionals during the COVID-19 pandemic. The AANA has issued a statement on utilizing CRNA's unique skill set as advanced practice nurses during this crisis. CRNAs play an important role in providing life-saving critical care management for patients impacted by the disease. We have heard from many CRNAs who are being asked to assume APRN roles outside of those traditionally held by CRNAs. In response, the AANA has assembled a group of CRNAs with critical care expertise to guide the Professional Practice Division in support of these members. We're also coordinating efforts with other professional associations, including the Society of Critical Care Medicine, to ensure that CRNAs are receiving up-to-date information on the care of COVID-19 patients. Practice resources, including an FAQ, an infographic, and links to a variety of additional resources can be found at aana.com/COVID-19. In advocacy, AANA has been working tirelessly to remove burdensome restrictions. On March 18th, our CEO, Randy Moore, met with President Trump, Vice President Pence, CMS Administrator Verma, and other key senior administration officials. Along with leaders of other national nursing organizations, he requested that federal agencies remove all regulatory barriers for CRNAs and enable all advanced practice providers to practice at the top of our education and training, ensuring that all healthcare providers immediately have appropriate PPE and sufficient ventilators and other medical equipment to accommodate the anticipated surge of patients in respiratory failure. Following this, as you all know, on March 30th, CMS temporarily suspended physician supervision requirements for CRNAs and announced an unprecedented array of temporary regulatory waivers and new rules to equip the American healthcare system with maximum flexibility to respond to the pandemic, enabling CRNAs to practice at full scope. To date, 12 state governors have issued executive orders to suspend supervisory restrictions for CRNAs. The AANA supports these positive actions and to enhance access to care for patients with COVID-19 and encourages other states to take action to expand the healthcare workforce during this critical time. Meeting with the administration is just one part of AANA's high-level advocacy initiative. Through direct relationships with Health and Human Services Secretary Azar, state leaders, along with the Trump administration, the AANA continues to work daily, hand in hand with federal and state lawmakers to remove barriers to practice for CRNAs. Recognizing necessary nonpartisan improvements, the work has been swift, particularly in Arizona, Maine, Maryland, New York, Ohio, Tennessee, and West Virginia. The AANA communicated with the National Governors Association, offering strategies for healthcare workforce and facility capacity, guidance that strongly encourages governors to allow you to practice at the top of your license. We're also working with Congress to address the economic impact this crisis is having on CRNAs. We know the economic and emotional toll that we are fighting for you and working hard to protect our members. In addition to our robust federal and state advocacy, the AANA has also fostered important partnerships, notably with the U.S. Department of Veterans Affairs, to secure employment opportunities for our members. Looking forward, the AANA is considering strategies to better meet member needs in a world after COVID-19. One identified gap is maintaining our critical care education and competency. There's also a need to provide more education and resources in business concepts, billing expertise, and individual financial management. These are a few of the areas we have identified in which we as an organization can help to better prepare our members for the future. In gratitude, I would like to thank everyone working both publicly and behind the scenes to help all of us maintain our sanity and safety during this crisis. This includes the frontline providers who are providing critical care management skills, intubation teams, line placement, sedation management, and weaning from ventilatory support. The CRNAs who are sharing innovation in patient care PPE, guidance on conversion and management, and safe use of anesthesia machines as ventilators. Program directors, clinical instructors, and students who are holding distance classes and simulation sessions in an attempt to meet graduation requirements during these uncertain times. The COA and NBCRNA who are listening to the challenges we're facing to meet requirements and are adapting timelines. The staff at AANA in Park Ridge who are preparing clinical recommendations, coordinating with other healthcare organizations, and preparing policy guidelines. Kudos also to our AANA Insurance Service for providing seamless service to our members throughout this crisis. To membership, communications, design, and marketing staff, keeping us informed through the media, website, emails, infographics, social media, publications, media, and telling our story. To our staff in DC who are connecting with the right people at the right way at the right time to effectively advance our practice rights. Thank you all for your professionalism, dedication, and support. The AANA wants to know what members need and how we can help. The AANA's Coronavirus Resources webpage, again, aana.com/COVID-19, includes a link to a form where members can let us know what they and their facilities are experiencing and what they need so we can communicate the information to the state and federal agencies. Thank you for your support of the association and for your membership. This is a difficult time for all of us, but we are all in this together. And together, we have the strength to come out stronger on the other side. Thank you very much and stay healthy.